How are acne scars treated?
Acne scars can be very distressing, and I'm often asked, what is the best treatment for acne scars? I can't give a universal answer to this question because there are different types of acne scars, skin types, as well as age ranges that have to be considered when recommending and developing a treatment plan. I'll discuss different types of acne scars and some of the procedures I perform for my patients. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I've been treating acne scars throughout my career and have continuously incorporated technologies such as lasers and radiofrequency devices, as well as surgical and non-surgical procedures to help my patients. I frequently see patients in consultation who've pursued acne scar treatment by responding to ads and having procedures which essentially burn their skin without longer-term strategy in mind. Oftentimes, this dynamic is driven by practitioners leasing expensive devices that are overhyped, which results in people being subjected to transaction-driven, high-pressure sales tactics rather than an unbiased, proper clinical evaluation and treatment. In my practice, I don't lease any of these overhyped devices. These devices cyclically come and go and create quick profits for device companies and medical retailers. If I feel a technology is effective, like any other instrument in my practice, I buy it and have it available for use when appropriate. Let's start with some basic concepts about acne scars. Acne scars result or occur after inflammation in the skin, which results in loss of normal tissue in the skin as well as the tissue below the skin. The body responds by repairing with scar tissue. This repaired tissue can appear depressed or indented and is referred to as an atrophic scar. Sometimes the body responds to tissue loss with excessive collagen production, and the area can look thickened and is referred to as a hypertrophic or keloid scar. Atrophic scars are classified in a basic and descriptive way. The terms we use are ice pick, boxcar, and rolling scars. Treatments for these types of scars are focused on stimulating collagen, skin resurfacing, volume replacement, skin smoothing, and skin tightening. With multiple variables that can potentially be addressed, a strategy needs to be customized for each individual patient. Conventional approach, particularly by practitioners with device lease payments, is to treat the outer aspects of the skin. My approach is to think from the inside or the foundational support of the skin and work from the inside outward. When I perform an evaluation for acne scars, I take standardized digital photos and backlit photos in order to assess the shadows and contours of the face to help me develop a proper treatment plan. A deficiency in bone and soft tissue projection will make acne scars look deeper. This is often recognized by people with acne scars who are in their 40s and older. As bone loss and fat loss occurs with aging, the skin has less tension, resulting in the scars looking deeper. This is a great opportunity to make a significant impact on the appearance of acne scars in just a few minutes. I routinely perform cheekbone enhancement using a technique called structural volumizing. I place long-lasting hyaluronic acid fillers at the bone level, comparable to what I would do if I were performing facial implant surgery. I've used this method successfully for younger people as well. The next level above the bone that's relevant is the fatty cell layers. This layer is relevant for rolling scars. Rolling scars are characterized by loss of tissue below the skin, resulting in scar tissue that tethers the skin downward. This is a situation where a technique called subcision is applicable. Different instruments can be used to release this scar tissue under the skin. After this scar tissue is released, the volume correction can be performed to expand this potential space. I routinely use long-lasting hyaluronic acid fillers when I perform subcision. In addition, I use platelet-rich plasma and platelet-rich fibrin matrix, also referred to as PRP and PRF, respectively. This technology is based on concentrating the wound-healing factors in your blood that are activated when you have a tissue injury, specifically the stimulation of collagen production, growth of fat cells, and generation of new blood vessels. The skin level consists of two layers, the dermis, or the foundation, and the epidermis, or the top layer. An example of collagen loss in the dermis resulting in skin depressions with sharp borders is called boxcar scars. This term refers to the microscopic view in cross-section. There is less thickness of the dermis and a relative disproportionate height of the epidermis. This results in the scars looking deep depending on the type of lighting. The goal is to reduce the contrast caused by the depth of the scar, so the strategy is to increase collagen volume in the dermis and reduce the height of the epidermis. This is where the lasers and various thermal energy delivery devices are applicable. For example, I use lasers such as fractional erbium, fractional CO2, and non-ablative Nd:YAG lasers. The challenge is that the scarred skin from acne has limited capacity to produce collagen to have a significant effect. This is particularly an issue when people have had multiple procedures. For many of my patients, I use PRP as well as combined PRP with hyaluronic acid, called skin boosting, to stimulate collagen and blood supply into the skin before performing any laser procedure. Most people who come to me for acne scars are aware that perfect, flawless skin is not the objective, but rather improvement of the skin, such that attention is diverted away from the acne scars is the goal. It's important to develop a plan and not just chase the shiny new devices being promoted on the web or social media. I often tell my patients to think of acne scar management with a long-term view like you would if you want to get stronger and build muscle in the gym. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.